Good afternoon. Thank you for coming this afternoon. May I have the first set of slides? Thank you. You've volunteered to come to something called the Current State of the Evaluation and Management of Lower Urinary Symptoms in Women. I'm honored to be on the stage with several very noted authorities in this field, and I'll certainly introduce them in just a moment. These are the usual affiliations that we have to list. I'm here on my own recognizance. We have approximately an hour and a half as our remit, and as you can see, we've tried to divide the discussion regarding salient aspects of the topic, current management of overactive bladder and lower urinary tract symptoms in women. So Omer Bayrek, who is from Gaziantep in Turkey, and who actually had spent some time with me in Nashville, will present epidemiology and population studies about lower urinary symptoms in women. Dr. Stuart Reynolds, who's one of my colleagues at Vanderbilt, was unable to attend, so I will present his lecture on chronic infections and inflammation of the lower urinary tract. Omer will then present the underactive bladder in women, diagnosis and treatment. Then it's a great honor to have Rami Onur, also from Turkey, who will present recent advances in the bladder pain syndrome. Our fourth discussant is Angie Rantel. Angie is a nurse clinician who works with in Linda Cardozo's group at King's in London, and Angie's an expert in the world and in the physics and the understanding of non-surgical treatments for lower urinary symptoms in women. I will have a brief overview of surgical treatments for lower urinary symptoms in women. Obviously, 20 minutes is far too short for that period, so I will focus on some very salient topics, especially about informed consent and patient education. And then we'll have a discussion for 5 minutes. If we end a little bit earlier, we'll certainly have time for more questions. So we urge you to ask questions and become involved, and we're more than happy to answer any that we can for you. So without any further ado, let me have Omer come to the stage and let him begin his presentation. Let me to remind you, our remit is that we will provide theoretical and practical knowledge of all outpatient and office procedures available for women in the management of the infection and inflammation of the lower urinary tract, underactive bladder, and bladder pain syndrome. And in addition, we want you to find a valuable resource with an interest in non-surgical and surgical treatments for lower urinary symptoms in women. So let's go on to the Dr. Bayrek slide, the next set of slides. Omer.